Okay, so I want you to get out a piece of paper for this because I want you to write some notes down. So today we're going to talk about how to handle a resistant dementia patient or elderly person that you need to either transition them to an assisted living or somewhere where someone else can care for them, or you have to have a caregiver come into your home because you need some extra help and some time for yourself. So, there's two reasons I can talk about this. Number one, I am a nurse that does assessments for geriatric patients, and I come in and bring caregivers into their home. And number two, because I'm going through this myself with my grandparents. So, if you have let me start with an older person. Older people are very resistant to change. Number one, because their brains can't handle it because they are slowly progressing, like their brain matter is slowly starting to shrink. So they can't handle stressful situations like they used to. And number two, because they are so used to being independent, and now you're taking some of that independence away, whether it's taking their car keys away or you're having somebody help them with very intimate things, dressing them, bathing them, helping them with the bathroom where they used to be able to do it by themselves. So it's very hard to go from independent to now dependent. You're losing all your self-control. You are not in control of your own body anymore, especially with like people that are having accidents. The elderly people that are having accidents are slowly not in control of their body. And then when you have to help clean them up, that's a very vulnerable situation, and they are really not in control of their body and what they're doing. So you might have to take some time, and over the course of a couple days or a week or two, and just have settled conversations and saying, Mom, Dad, Grandma, Grandpa, obviously you're getting older and we need to, or you can say, we need to have somebody come in and help you out. So, or you could say, maybe you don't need to say, obviously you're getting older. I mean, I say it to my grandfather because it is what it is. Some people don't take that as well, and they get aggravated or insulted by it, but it is reality, regardless of whether you want to know it's reality or not. So we are going through the same situation with my grandfather, and he is very resistant to this. So I call him Poppy, and I said, Poppy, you're getting older, obviously, and we need someone to come in to help you. Nanny can't do it all by herself, and you yell at her constantly. You call her for everything, and you will not get up from your chair, which he won't. So in order to take some of the pressure off of her, because she's older as well and can't do everything for you, we need someone to come in to help you out. Now, I say it with a stern voice. I've always been like this. Some people are more gentle. I come off a little abrupt and brash, but it's because with certain type of people, there's certain type of people you can be like that with. There's certain type of people you can't be like that with. But for my grandfather, he's so I need to be abrupt and upfront with him because he can be and is very mean. He's always been like that, very abrupt to the point. So I am abrupt and to the point to him. And so he kind of backs down from it. And he said once, like, Lindsay yelled at me because he's used to being the one that yells. And I said, look, stop yelling at Nan. This is unacceptable. You do not yell at your wife like that. And so then he kind of backed down. He was like, Lindsay yelled at me. So I have been upfront and to the point. Now, I live in a different state than they do. So it's kind of hard to toggle in between all of these things to coordinate it. I've always been on the other side of it, where I've been the nurse assessing potential clients for their needs and bringing caregivers in. Now I'm on the flip side of it, where I am having to coordinate all of this stuff so that we can get my grandfather care. Now, usually the care coordination comes from the children. However, my mom, there's 3 siblings. My one uncle has brain cancer. My other uncle had a stroke and can't really coordinate anything, and he doesn't drive. My one uncle with brain cancer doesn't drive. He lives down the road from them. And then my mom and I and my son and my dad live in a different state. So because I'm an RN, because I have done this before, I am coordinating the care and coordinating all the medical records and the power of attorney and things like that, which is kind of uncommon, I guess, because the guy asked me, why is the granddaughter coordinating this instead of the children? Because it's usually the children. And I said, well, we're kind of in a sticky situation. Plus, I've already done this before. So, this isn't new to me. But it is new to me being on the flip side of it and coordinating this care. Now, when I was a CNA, I had 2 older people that I went in their home, and they had 4 children, and one of their daughters was a nurse who I actually worked under, is how I got involved with them. They were 2 people who you kind of had to be careful with in explaining things, because they would get insulted very quickly. So for the nurse's mom, who we needed care to come in the home, she said, Mom, you cannot cook anymore by yourself. It's very hard. It's hard for you to get out of bed by yourself. It's hard for you to put on your shoes by yourself. You haven't taken a shower recently, and your hair is not curled, and we haven't gotten you to the hairdresser. So I'm thinking it would be a good idea for us to bring in some other people to help, because I have a full-time job, and then the 3 siblings had full-time jobs. So she named the 3 siblings and said, I think it would be in all of our best interest for us to have some extra help. And she was like, well, but if you state, so it kind of depends on how you talk to the person or how they talk to you. But if you state the things that they need help with, and even if they're resistant and say, well, I can still do that, you can say, well, the last time you bent down, we had to get a shoehorn to put on your shoes. Or the last time you bent down, you fell on your face. We can take those things and make them easier for you. So you're going to make it all about them. To make it easier for them, we're going to take all those things that you're having a hard time with, and we're going to have a person come in to help you, because we want to make sure that your quality of life is as good as it was before. But now we kind of need someone to help you out more. But we're doing this because it's in your best interest if we have someone help you out. Now, that's a nicer, easier way to go about it. So it kind of depends on the person and your relationship with them. And sometimes they can still be resistant to change. But the problem is that if you state all of that and they're still resistant, then you can say, well, listen, safety is our biggest thing, correct? And they'll say, well, yeah, obviously I don't want to fall. Or you can say, well, you're on Coumadin. So if you fall and hit your head, you can bleed. And then who's going to be here to help you? Or if you bump into something, your arm is going to be all black and blue from the Coumadin. So, we may need someone else to help you. So if you just keep reinforcing, and again, it may take a couple of conversations. And then you can also, when they have their next doctor's appointment, have the doctor reinforce, listen, it would be in your best interest to keep you safe to have someone come in and help you. Then you get the big reinforcement, because most patients that go to the doctor a lot and respect their doctors take their doctor's word sometimes over the children. So if they say, okay, you can say, Mom, I'm telling you that, I think it would be in your best interest to keep you safe as possible and to keep your quality of life that we get someone in to help you. And then Dr. So-and-so also said the same thing. So now we're having two people say it. I think we should really look into this. So most of the time they'll say, okay. So then after that, then there comes the coordination part. Now, if you are transitioning then from your home into an assisted living or a nursing home, that is a big transition. And their brain may not take it as well. So if you have somebody that has dementia and they don't know what in the world is going on, but they were kind of normal, but you still need help when they're there, but then you're transitioning them into an assisted living or nursing home, potentially they're going to have uproaring behaviors that they never had before. They could have sundowners where they're up all night pacing. They could become combative. They could become violent. They could become physically or emotionally violent with you, of spewing their words. You have to understand that those transitions are a huge transition for them and their brain can't handle it. So anything they say or do that is not normal for them, you cannot be frustrated with that or take that as a personal insult. It has nothing to do with you. It's just their brain is scrambled already, and then you're taking them out of their home, their safe place, and putting them somewhere else. So you just have to remember, if you had to move abruptly, you're thinking all these things, your brain is going a million miles a minute, you're in a different place than you're used to, you have all these different changes. And sometimes as normal people, we can't handle change very well. So you have to understand that a dementia patient is not going to handle the change very well. Now they may say, like I had a patient, not my patient, but I had my son's babysitter's father-in-law went into an Alzheimer's nursing home. And they said that he was up all night. He had sundowners. He was trying to get out. They had to put a alarm on his ankle to make sure that, if he got out the doors, that the alarm would go off. He had all of these behaviors that were completely different than he had had before. And again, it's because he was transitioning from seeing his wife every day, his children every day, his grandchildren every day. Even though he didn't know who he was, who they were, he still saw their faces every day. He had a normal routine. Up, breakfast, shower, bathroom, sit down, watch TV, read the newspaper, or whatever his daily activities were. And you're taking that and transitioning him into a single bed with another person in the room. You have all these people in scrubs, staff, the lights are all on all the time. Now you're having breakfast with a different group of people who you never knew before. You have to take all of these things into consideration. And he did not adjust well. So they had to readjust his medications. They brought in a doctor to see him. They had to take him to another doctor because they had to readjust all of his medications because he was not adjusting well. But it got to the point where he in his house was not safe with his wife because he would walk out the door and go wander down the street. And his wife couldn't physically pick him up or help him in the bathroom anymore. When you're sitting down and your knees don't work and somebody's pulling you, they could potentially pull their back, especially if they're an older person themselves. So it's very hard. But you just have to remember, if you're transitioning them from your house to a nursing home or assisted living, their brain and their change of behavior may be so drastic and dramatic, but you just have to remember that change is very hard in an older person, and their brain is already jumbled, so you're jumbling their brain more. However, safety has to be the number one priority. So if you feel at any time, now there's a couple ways to say safety. So like if you feel like they are physically or emotionally violent to you, well, that's not acceptable, even in their demented state of mind. That's not acceptable. So that would be a safety issue for you and for them, that they are not safe in their home. Also, safety can mean if they are potentially going to roll out of the bed by accident, or they're going to trip over some rugs because you have all these throw rugs in your house and they have their feet and they shuffle. They can't pick up their feet. They shuffle. Or if they have a walker and you have all these throw rugs down and then the walker doesn't go over the throw rugs. Or if you have a step-in shower and they cannot step in because they can't bring their feet up. Those are all safety issues. You can do things to prevent the falls from happening. Pick up the throw rugs. You can install a different shower. You can get a toilet seat lift so that they're not sitting down, way down low. You can install grab bars, handles for stairs. There's all these certain things that you can do. But if you have all of that and there's still issues, that's when it's time to reevaluate. So all of these, you need to take all of this into consideration. So I, told you before to get a pen and paper, but I'm kind of going all over the place because there's just so much to talk about regarding like safety issues, how you talk to them, if you can be abrupt with them, if you have to be a little more gentle to them, if you need a caregiver to come in, or if you need to transition them to assisted living. So there's lots of things that we can go over. And then I'll also do more videos on this. But I want you to, number one, be aware that if there's any safety issue whatsoever, that needs to be the first thing that is addressed. Because even with children, so you're kind of, when you get into older adults with dementia, they're going backwards to being a kid. They're just a lot heavier. So you have to make sure you think about what a kid would do. Anything that a kid could potentially get into or potentially get hurt on, you have to think about that with an older adult. But they're more fragile, they're heavier, and they're on medications, potentially on medications that could have severe damage if they fall. So safety needs to be the number one priority. You also have to think about you. As your loved one ages, and sometimes it gets overwhelming for you. If you need to take a step back and say, I cannot handle this anymore, that is perfectly fine. That is why there are caregivers to help. That is why there are nursing homes to help. Because there are some times when you cannot physically or emotionally handle any more things than you can. And that's perfectly fine. So I need you to understand and really understand, because I have been on the receiving end of people with loved ones that have had a harder time transitioning their loved one into somewhere because they feel like they're failing them. Then the actual loved one is okay. But the person who has to make that hard decision feels like they're failing the loved one. I want you to know and hear this and understand that you are not failing them and you are not failing yourself. There are some situations, circumstances that are above your pay grade, so to speak, and that you may not be equipped to handle emotionally, physically, financially. There are some situations where it just gets to be too much. And then there's people that you see that, have helped their dementia husband for 10 years and they do everything for him, which was one of my aunts. My aunt helped her husband that had dementia for 10 years before he died. And she did everything for him. She had a Hoyer lift to hoist him up. She did everything for him. But this woman is exceptional. I swore when I became a nurse that I would never transition my parents to a nursing home. But there are some situations where you are not able to handle it. If you have a full-time job, if you have to watch your other grandkids, if you have other things going on in your personal life and then have to deal with this on the other end, sometimes there are situations where it's okay. Now, as long as they're, you're making the correct decision about where to put them, if they have, reviews online that are really good, if they have ratings from like the Centers for Medicare and Medicaid. There are certain websites that you can go on to make sure that your loved one is going to be in a respectable and good facility. If that all is okay, it is totally fine for you to transition them. I want you to hear that and understand that and know that, because there are lots of times where people will just say, well, I'm taking care of my husband now, but he took his whole life and took care of me. I was able to stay home with my babies and raise my babies, and I have no education, and, I can't just go get a job anywhere. And now it is my personal duty to take care of him because now he is sick and it is my time to take care of him. If you feel that guilt or that failure, again, it is totally fine for you to take the pressure off of yourself and put your loved ones somewhere where they can get all of the care 24/7 that they need, because this is a 24/7 job. This is just like raising a baby, but they're heavier and stronger and have very hard, harsh opinions sometimes, and their mind is all jumbled, and there's certain medications that fix that, but sometimes that hinder that. And there's so many other medical issues that could be going on. Again, it is totally fine for you to transition them if you can't handle it. So if you like this, give it a thumbs up, subscribe to my page so that you can get all of the new, fresh information that I am doing, and I will see you guys later.